Good morning to all of you. My name is Dr. Moro Salifu. I am the chair of medicine. I also direct the Brooklyn Health Disparities Center at Brooklyn. The aim of the Brooklyn Health Disparities Center is to eliminate or, at the minimum, reduce health disparities in Brooklyn. We are NIH funded and we have a lot of collaborations. I'd like to welcome all of you. Joining me today on Zoom is my co-sponsor for this meeting, Dr. David Tuverson from Cold Spring Harbor Laboratories. Cold Spring Harbor, as you remember, is the institution that actually discovered DNA. It's a very powerful NCI designated cancer center in the United States, one of the premier institutions in the USA doing cancer research. And Dr. Tuverson has been with us for a long time, for the past 10 years, trying to promote cancer health disparities research and also to bring this conference to fruition. I also want to acknowledge our Dean of the College of Medicine, Dr. Charles Brunukadi. He's over here. He's going to give opening remarks very soon. And to thank all of you for coming this morning. We have over 150 registrants coming in person, and also another 100 or so online. So it's quite a sizable conference, symposium. I'd like to thank the External Advisory Committee or Board. We've been working with an External Advisory Board for the past 10 years. It started with us looking at the question, what is the biological differences in GI cancers between African Americans and whites? That was the main question 10 years ago. We had a number of grants to support exploring the idea, why there are biological differences, and we've been exploring this same idea for the last 10 years. We subsequently got NIH funded through a P20 mechanism in 2015. That P20 mechanism transitioned into other grants, including the New York Genome Center grants that were just concluded. So throughout the 10-year history, we've essentially been funded to do this kind of work. I also want to thank Laura Martello Rooney, who is sitting at the back there, who's the architect of all the meetings for the last 10 years. She's done phenomenally well in organizing and bringing the topics and engaging everybody the right way. So thank you, Laura. I mentioned the External Advisory Board briefly. I want to acknowledge Dr. Antonio Baines, who is in the audience here. He was one of the first to be invited to be one of the External Advisory Board members, and he's been phenomenal. He hasn't missed a single meeting in the last 10 years as an External Advisory Board member. So thank you, Antonio. So we will get into the meet now, which is the first order of business, is to invite the Dean of the College of Medicine to give opening remarks.
Thank you, Dr. Salifu, for inviting me to give the opening remarks. So good morning and welcome to the 10th Annual Cancer Health Disparities Symposium. This symposium is the first of its kind in the United States, focused solely on cancer health disparities. Now in its 10th year, we have invited experts from around the nation to present and discuss ways to bridge racial gaps that we see in cancer rates and outcomes. We celebrate the tremendous block of work accomplished over the past decade under the leadership of Dr. Moro Salifu, Dr. Laura Martello Rooney, and Dr. David Tuverson. The Centers for Disease Control states that health equity is achieved when every person has the opportunity to attain their full health potential, and no one is disadvantaged from achieving this potential because of race, ethnicity, social position, or other socially determined circumstances. Here at Downstate, we focus on health equity in our patient care, in our research, and in educating the students. Now, achieving health equity through cancer research and treatment in order to eliminate cancer health disparities is a critically important goal for all in the medical and biomedical professions. Now, since the first symposium in 2015, we've seen a growing interest from the Downstate community and increasing attendance. This clearly demonstrates that this work has value and our providers want the work to continue. So today's symposium focuses on the increased risk of gastrointestinal cancer, specifically colorectal and pancreatic cancers of individuals of African descent, as well as other cancers. Our keynote speaker, Dr. Janita Hughes-Halbert from the University of Southern California, will share her insights on translational research in cancer and health equity. Today's discussion will cover multiple topics in cancer research, screening, and treatment, with a particular highlight this year on advancing health equity in clinical trials. I look forward to hearing today's presentations and panel discussions from cancer researchers, clinicians, cancer survivors, patient advocate, and others. Again, welcome to our 10th Annual Cancer Health Disparities Symposium. Thank you.
All right. So the first part of the conversation has to do with taking us back 10 years ago and then seeing what has happened till date. The symposium started again 10 years ago, as I mentioned before, and we've had a number of very, very important guests come to speak in this symposium, and I just wanted to go through them briefly for you to appreciate what has actually happened. This is our first symposium, the first annual Cancer Health Disparities Symposium. You can see that we're focusing more on pancreatic cancer and also colorectal cancer. It was a collaboration between the various institutions. And we had Dr. John Carithas. Dr. Carithas is he was the chair of medicine at University of Michigan Medical Center for a very long time, heavily NIH funded, very acknowledged in the GI community for colon cancer research. He's now the executive chancellor at University of University of California in San Diego. He would have loved to be here. He was our first chair of the External Advisory Board, and he did a lot for us to establish the P20. He reviewed, he came, he did everything possible to create a collaboration, help us create a collaboration between SUNY Downstate, Cold Spring Harbor Laboratories, and SUNY Stony Brook. We really thank him a lot for all the contributions to this symposium. And then you can see we had other participants from the New York State Department of Health, the American Cancer Society, Health and Hospitals, and so on and so forth. This is our second annual Cancer Health Disparities Symposium. This was also well received. You can see each time we have a symposium, we have a theme on the cover page. So as you move through the conference, look at the cover page of for this year. It's really very nicely done. It takes you through some of the key things within this particular period of time. So here you can see we sort of depicted the trends in death rates for selected cancer sites among Blacks and whites. And you can see that, of course, the cancer, incidence rates are much more in African Americans, and the death rates are much more compared to white Americans. And then the speaker was Temitope Keku from UNC, University of North Carolina, Chapel Hill. We also had speakers from Weill Cornell Medical College, University of Albany, and B stage 3 cancer. The third annual Cancer Health Disparities Symposium, same thing. We focus more on cancer screening. You can see we had speakers from the keynote speaker was Beverly Lynn Cook from the FDA, and we also had speakers from the American Cancer Society and then University of Michigan and others. Here depicting all the cancers and how we screen for these cancers. The fourth symposium was very, very interesting. You could see that. Can you remember who this is? Or seen pictures of Henrietta Lacks? The grandson of Henrietta Lacks actually highlighted this particular symposium. He came, he gave a very nice open forum mic, and it was just emotional. The story of Henrietta Lacks and the HeLa cells and what the NIH is doing with them right now. It was really, really a moving story. So the grandson, Alfred Lacks, actually highlighted the symposium, but we had speakers from NYU, Mount Sinai, Weill Cornell, and other institutions. The fifth annual Cancer Health Disparities Symposium was focusing on the gender differences. You can see the collaboration again. The keynote speaker was Kevin Cassell from University of Hawaii, and we also have Georgia Institute of Technology, Weill Cornell, It sounds like Wild Cornell is quite a regular presence here, so thank you, Wild Cornell. The sixth one was more on AI and cancer, artificial intelligence and cancer health disparities. The keynote speaker was Otis Brawley from Johns Hopkins. We also had speakers from University of Puerto Rico and a lot of, I think this is Mass Medical Center and the New York Genome Center, the Moffitt Cancer Center in Florida, and Weill Cornell again, University of Kansas. A lot of participation around the country. The 7th Annual Cancer Health Disparities Symposium, you can see was, we're basically predicting the increase in cancer risk, and you can see how the cancer rate goes by factors. I think smoking is a big deal here. Same collaborations, you can see the 4 collaborations here. And we had Edith Mitchell as the keynote speaker from Thomas Jefferson. This was also a very nicely attended conference. The 8th Annual Cancer Health Disparities Symposium was now more global. We're looking more on the global phenomenon going on. Same collaborations. This time we had John Captain from USC, University of Southern California, be the keynote speaker and highlight the symposium. It was very nice. And we also had speakers from Memorial Sloan Kettering, Community Health Network, Maimonides Medical Center, Morehouse, Vanderbilt. Very nicely done at that time too. The 9th Annual Cancer Health Disparities Symposium was focused more on the interactions, as you can see, social determinants of health and how that interacts with the cancer. And again, the collaborations. And the keynote speaker here was Andrew Randall from Columbia University. And we had MSK, Memorial Sloan Kettering, Yale, Weill Cornell, Brooklyn College Cancer Center, and the like. Also very nicely attended. If you look at the 10th Annual Cancer Health Disparities Symposium, it's really very nicely done. It talks about the clinical trials and how difficult it is to get people into clinical trials. Right now, only 7.1% of patients actually make it into cancer clinical trials. That's a big problem around the country. And this is even lower for people of African descent or African Americans. So we have a lot to do in promoting research and making sure that we get more people into clinical trials so that we can learn more about some of these very, very difficult cancers. So that is the history of that. And then the last piece of slide I'm going to talk to you about is addressing the impact of COVID on GI cancer or cancers in general, so that we can begin to think about how that is going to influence the next 5 years in terms of our research processes. So you can see before COVID, that is 2020. This is for men. This is for women. This is the number of cancer deaths averted, that is prevented, right? So if we did the right things, the deaths went down. This was the projected death. So before COVID, things were really very good for men and also for women. It's just that the gap was more for men than for women in terms of the number of cancers that could be averted. If you look at the leading cause of death in the United States in 2020, COVID-19 was one of them. Big one. Of course, heart disease always maintained the status, cancer number 2. So they are all connected. So we're addressing these two. We're addressing cancer, but COVID-19 is right behind cancer, actually, in terms of mortality. If you look at the top 10 cancer incidences and mortality for men and for women, prostate is still the leading for men, right? But in terms of male death, is lung cancer, right? It's lung. And then colorectal cancer is right behind lung in terms of prevalence. Okay, so, but in terms of mortality, you see it's almost, it bounces back to number 4. So this is where we are focusing on colorectal and pancreas for this particular symposium. So it's very, very critical that we find solutions to these issues. And for women, it's mostly breast cancer, but in terms of mortality, lung is number 1. But you see the pancreas and colon comes back again. So we have a real mandate in terms of research to be able to address these issues, find solutions. If you look at the impact of COVID-19 on the future cancer outcomes, what happened in COVID-19 was just mainly reduction in access. People weren't just, they weren't able to get to care. That's basically the main problem here. You have reduced access, fear of infection, reallocation of healthcare resources, unemployment, all these other social determinants happen in COVID-19. And then that is driving the rest of the stuff for cancer. So prevention is affected by these, problems. Diagnosis affected by these same problems. And of course, treatments are also affected by these problems. So we are going to be seeing a lot of cancer mortality because of that over the next few years as a prediction. And then this is a slide showing you the estimated excess deaths from colorectal and breast cancers. So before 2020, it was sort of, quite flat. But you can see that these are the excess. In other words, if COVID didn't happen, we would have been around here. The graph would have been in this level. In other words, the number of deaths would have been around here. But these are the excess deaths due to COVID for cancer. So it's real. There's actually a connection there between what happened with the COVID-19 pandemic and how people are actually getting care across the board. And cancer is not an exception, right? People have to do so many things to get the care. So if you can do those things to get the care, then you are impacted. And then these are the trends for, these trends are well known, trends in the incidence of cancer for, Black, white and Hispanic. This is well known, but we don't have these graphs after 2020. So I'm very curious to see the next report for this, what happens in the incidence and then the mortality. Hopefully next year when we have the conference, we will probably have next reports of this and then we can see some, what that actually means. All right, so that ends the introductory remarks from me. I'd like to thank all of you again. My partner, Dr. David Tuvison, the External Advisory Board, Anthony Baines and David Carothers, my dean for always supporting us, all of you for always coming to the conference. And I wish all of you a phenomenal symposium today. We're going to rock. It's going to be very nice. So